Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to deal with another pediatric orthodontic case where the person has a pretty bad cyst. And this was a cyst that I wasn't real sure how I wanted to treat it, so I sent this young lady to an oral surgeon to deal with this cyst. Now, oral surgeons are used to just going in and opening, taking and peel the cyst out and everything and get through with it in just a matter of not a few minutes, but there's a little period of operation here going on, and this is heals up and let's take the cyst out. But in this particular one, the molar had been pushed forward, and the molar was in the way, and he took the molar out too, instead of letting the molar come back into position like we did the case that's in the other deal here. So let's get going on this, and I'll try to go through it as fast as we can. This is a young lady, and you can see the facial structure doesn't show this up very much. I mean, this is a good face too, like the one we just got through showing you. And so she's got a tremendous cyst on the right side. If I remember correctly, it was the whole, this side was blown out. It'll show on the x-ray here. And she's got a crowded situation, not like the other young lady, but somewhat crowded, but we can deal with that. Now, here the cyst is in this area back in here, and it'll show up on the x-ray. It's a huge cyst back there. And that's the other side of the mouth. Now, when you look at the x-ray of it, you can see a difference in this side over here, where this tooth is pushed out of place right in here. I'll erase that so you can look at the difference. And this is more the normal side over here on that area. Now let's look again here. Now here is the cyst. I mean, this is the cyst. All this area back in here, it goes way up in there. And so they go in, and the oral surgeon did. Now you see this, here's a 6-year molar, here's a, look like a 12-year molar that's normally would have been back in this area of the mouth. Now that molar is pushed back in this corner here. And the oral surgeon wasn't aware that this tooth, if you had treated it in a slow method, you could have opened up this area and kept it open, then this tooth would have moved back into position, so you would have had it here. So I don't want to run down the old surgeon. He did a good job with the cyst, but he should have left this cyst alone, and this could have come back into position. Now let's get over here, and I'll take this uncovered so you can see it better. I mean, this is a huge cyst, and we're going to show some of the operation here. So here is the cyst. Now it's in this area. Now he keeps this tooth and these teeth here, but this tooth here was shoved back up underneath here. And so when he took the cyst out, he just took the tooth also. There's no 12-year molars. Well, we got a wisdom tooth up here and wisdom tooth here, and I don't see a wisdom tooth on either down on the upper, or I mean on the lower arch. Now this, but you can see this tooth is shoved way up underneath here. Okay, he injected a syringe in here and aspirated, and the fluid coming out of this cyst was kind of slightly bloody fluid coming out, probably going in and taking the blood out and everything. But he knew it was a cyst and he could see it in there, so they go in and do the operation. Now, I did not scrub in on this or see it, but he gave me some pictures that he took. Now, he came in and took this section of bone completely out of there, and then he peeled the cyst out of the tissue where it wouldn't be there anymore. Now here it is after the bone has been removed up in here, and he peeled this cyst out. Now you've got a good piece of the bone structure gone in here, and that tooth that was shoved up underneath here was down here, and this is the 6-year molar, and that other one was kind of underneath here, and he went ahead and took it out too. Now, I feel strongly after seeing how the other case did, if we had opened a big opening over here and kept it open, this cyst would have gone away and this tooth would have come back up in position. Now I'm going to flip back and go back and show you where that tooth was. Now you can see the tooth there, and then you can also see where the tooth is right here. Now we're cutting over there, and when he took this out, you can see the top of this tooth right here. If we had opened the wall of the bone here and drained that, or opened it from anywhere and kept it open, I feel this tooth would have moved back in position like the cuspid did on the young lady that we showed in the other view right here. So I want to erase that, and you can see that tooth where it is. And the rest of this came in fine, no problem. There's where he aspirated. There's where he moved the tissue back, and then he cuts this, and he comes over to this, and instead of leaving that alone, he takes it out. Now, I doubt if you took the cyst away like he did, that this tooth would have drifted back in here. I'll show you the cyst. He actually pulled it out and did a biopsy on it. Now there's opening this up, and that's gone. And now this is clear. Here the bone structure is around in this area, and he'll lay the tissue over that. It heals back up and everything works, but the young lady's missing the teeth down there. This is the cyst. He got a picture of this, and he sent it to a lab, and it's epithelial tissue. It's not cancerous or anything. And that is a large piece of tissue that he peeled out, so there's nothing left in there. And there's another view of it, and this is epithelial tissue, and they peeled that out. And this is where they sliced into it and did some microscopic study of it, and that's the way epithelial tissue looks with a certain dye in it. There it is, a close-up. And that's as far as I have any pictures on this case, but I wanted to go in and show that to you. So this is a fast way of dealing with a cyst, but personally, I would rather have left this tissue over it and gone, if I knew what I knew after seeing that young lady, take the bony structure in this area right there and kind of do away with that and keep this open. And I'm going to tell you in another video on some cysts that I dealt with in Africa. So I'll just stop here on this one and then I'm going to tell you about 2 cysts that I saw in Africa. It's unusually large cyst. One of them is I've never seen anything like it before. So we'll sign off now and say thank you for watching, and I hope you'll join our group and subscribe to it. And we're in the American Orthodontic Society. If you want to learn orthodontics, you can come to the American Orthodontic Society and sign up for the different lectures. They're going to teach you how to do this. So thank you for watching, and I'm going to sign off now.